This is Pretty in Practice, the podcast.
Opinions expressed on this podcast are solely those of our own as well as our guests and do not reflect the views and opinions of our respective employers, organizations, academic institutions, committees, other groups, or individuals.
Welcome to another episode of Pretty in Practice, the podcast. Today, we have a special guest, Derwin Hall, who is a fellow PT as well, and one of my good classmates. So it's awesome to have you here.
And I just want to say thank you guys for having me. I'm truly honored, and just sitting in this room with these beautiful Black queens, man. This is an amazing opportunity.
Thank you. We appreciate that. So we felt like we couldn't speak on men's health without having a man in the room. So we don't want to speak from a perspective that we know nothing about. But like I said, today we'll be talking about men's health. But before we get started, we'll start with our doctor's diary. And we'll have our guests choose a number 1 through 12, which will choose our question for us today.
All right, let's go with lucky number 7.
7.
That's a great number.
Is it? You should have said it.
Favorite number.
All right, so Doctor's diary question is, what would the title of your autobiography be? Or theme song?
Oh, that's
A good one.
That's a good one. Guess, do you have anything? I think I have something top of mind.
I'm gonna say failure is not defeat.
Ooh, that's deep. I like that. Okay, good. Mine would be success against all odds. Like, that's my little mantra. I would probably be The Voice because I'm a huge advocate for the Black community. Yes. How did y'all come up with those?
I got one. My little favorite saying of nevertheless she persisted probably would be my title.
I really don't know. Oh my goodness.
Resilience is key. I don't know. Something about resilience.
Let's go with it.
I love it. Yeah, all right. Okay, so jumping right into men's health, we want to start with some statistics that really drive home how important it is for men to seek help and the fact that they don't. So according to the CDC, the leading causes of death in Black men, number 1 being heart disease at 24.1%, and cancer being number 2 at 19.7% of those deaths. So just breaking the cancer down a little bit more, the most commonly diagnosed cancers among those Black men are prostate cancer, being 37% of all cancers in Black men. Then following that is lung and bronchus cancers at 12%, and then colon and rectum cancer following that at 9%. And then just to drive more on that prostate cancer, 1 in 4 men will get prostate cancer. 1 in 4 Black men, I should say. And that's just crazy to think about because I know we can all think of 4 Black men and one of those people would have prostate cancer. So that's pretty crazy for me to think about. And then, so with that being said, I know we all have men in our lives who may or may not take their health serious. Do any of you guys have any examples of this?
I think in general, at least from what I've experienced with Black men, is the fear of going to the doctor. And we know that definitely stems from historical, things that have happened historically, which I know we'll touch on later in the episode. But it's very hard because there's an understanding of why, that mentality is there. But unfortunately, it's harmful. As you said, prostate cancer affects 1 in 4 Black men. But the other side of it is that it's very treatable with early detection. Yeah. And so unfortunately, with a lot of Black men, they don't want to go to the doctor. And so unfortunately what happens is when they find out about it, it's too late. And it's something that could have been prevented with regular checkups and early detection. I could definitely say from my experiences with, the men in my life, there is that fear there. They don't go to the doctor as much as they should. The annual checkups don't happen annually. So I definitely can say that I've experienced that for sure.
Yeah, I agree. I think just adding on to just the fear of going to the doctor, I think another aspect of it is just the lack of knowledge too.
I know for me, my grandfather died of prostate cancer, and I know especially back in his time, he didn't have knowledge about the seriousness of the condition and how it affects the Black community. So that was a gap, and even the man in my life today don't really have the knowledge. My stepdad, he definitely don't take his health seriously, but he he came here from the island, so he's from Trinidad. And there they don't have a lot of healthcare resources. So when he comes here, he's just used to kind of doing whatever he wants to do, eating whatever he wants to do, drinking whatever he wants to drink. But that led to him having high blood pressure and all different type of cardiac issues in his life. And I have to be the pharmacist and tell him, hey, take this medication. But he's also one, like I said, lack of knowledge, and then he doesn't really trust the system at all with any medication, any healthcare services. So I have to continue to push him to take his medication, especially for the serious diseases that he has. And then with my husband, I think with him, he's just like macho. He wants to look like he's just a strong man and show no weakness. A lot of Black men, unfortunately, are raised that way, which I understand just based on everything that they face in the world. Right. But with him, he just wants to stick it out to the end. Even if it's a cold, if it's something small, big, he wants to ride it out to the end because he feels like that might be showing a little bit of weakness.
And I can also weigh in on that because we actually learned that in school recently, like that toxic masculinity, which is when like men, and this can apply to any man, like you feel like you have to be strong, but like how can you be strong if your health isn't good? Exactly. So that's something to keep in mind. And I guess my examples would be from people that I date. So like I had one guy that I dated. He said the one time he did go to the hospital because he was having like some visual issues. He found out he had a brain tumor. Oh, wow. Thankfully, he got that removed. But ever since then, he's scared to go back because he's like, the one time I went, it was bad news. Like, could have killed me. And so now he's scared of that. And then someone else, he didn't even have health insurance when we started dating. And I pretty much convinced him to get health insurance. He's like, well, I'm healthy, I'm young. And I'm like, well, what if you get in a car accident tomorrow? Like, there are things that we can't predict that can happen and affect our health every single time we get out of our bed. So that's why it's like super, super important. You are still strong. I think you're even stronger if you're taking care of your body. So please keep that in mind.
Definitely. And I have something to add to that too. Just thinking of one time my uncle and I were in Walmart and he happened to want to sit down in one of those blood pressure things. And his thing came back like 200 over 100 or something. I'm like, wait a minute, he's laughing. And I'm like, wait a minute, no, like that's not this was funny, but this is not funny anymore. Yeah. Like, that's not okay. Like, so I tried to drive that home. I tried to get my aunt who's a nurse to also drive that home. Like, you need to seek help. And then to this day, like, now we know that he has like pre-diabetes or at the point of diabetes already. So now he's actually actively managing that. He's like changing his diet and paying attention into like the sugars he drinks and the things like that in his diet, which is really good to see that he's taking it seriously at this point. Because just I know he can see that in his dad who had diabetes. He had multiple amputations because of diabetes because it was uncontrolled and he didn't take care of it. So I'm glad that he's learning from that. But since we have a male in the room, Derwin, we want to know your perspective. Do you notice this? Do you have toxic masculinity? Like what's up?
You know, of course, man. I think I just have to take a deep breath because that's a tough conversation. You know, everything that you ladies talked about is something that we men struggle with. Fear. The masculinity, you know, man, we don't really know what toxic masculinity is because all we've been taught is to be strong, you know? Lack of education, that's real. And me being a physical therapist, you know, like, it wasn't until I went to physical therapy school and got an education to know that, you need to go get checked up. Like, these annual appointments are important because for me, I was raised by those traditional men that, you know, you want to talk about the Tuskegee experiment. And that's something that our viewership probably Google because that is a plague that really affected the Black community. So, should we elaborate a little bit more?
Yeah, I'll take over and talk about that Tuskegee project. It was a study looking at syphilis in Black men. It began in 1932. They had 600 Black men, which 399 of them had syphilis. And the other participants did not. Something that is very important to know about this study is that these men really had no idea what was going on. They did not give their informed consent for the things that were going to happen to them because what it wasn't laid out clear for them to know what was going on. These were low-income men who were kind of gauged into this by the fact that they were offering free medical care, free meals, burial insurance, which are things that they couldn't afford. So, of course, they jumped on it. And so it began in 1932. In 1943, penicillin was found to be the treatment of choice for syphilis. So that's already, a couple years there. And so it was widely available. And the researchers over the study still decided to withhold that treatment because they wanted to see the progression of syphilis without medication. Like, what will happen to these people if we don't give them medication? Most likely probably to prevent it in other people.
Of other races.
Yes, we'll say it like that for sure. So, 1943 it was available, and it wasn't until 1972 that it was recommended that this was unethical, and the study was stopped. So, of those probably 399 participants, many of them died, many of them suffered different things like blindness and other things that they did not have to have simply because they were treated like lab rats, like
Exactly.
a lab rat. Like, so yeah, could you imagine like hearing about that and knowing that they treat you like a lab rat, and then trust today that they will treat you like a human that you are is it makes sense. So I mean, I can't blame them at all.
Right. So think about that. Like, those men that were affected are essentially our generation, our grandfathers. You know? So we're being raised by these men that have that experience. I mean, there wasn't TikTok back in the day. You know, they didn't have someone pointing to the sky, but they did have word of mouth, and they knew how to communicate. So you think about these men, these black men trying to have a community, probably not even seeing a doctor, and the doctors come into your community and say, hey, we can help you.
Right.
I mean, you put your faith, you put your trust into them, and then you have to deal with the plague of your children's children being affected by something that the government, the doctors, the people that don't look like you said that they would help you with.
Exactly. Did the complete opposite.
Yeah.
Literally.
It's
I mean,
something you know nothing about.
Yeah.
Like, that's the hard part. Like, they don't know anything about healthcare or medicine or anything, so they literally had to trust them. Like, so that's
And that angers me as someone. I work in a field where we conduct clinical trials, and a lot of people that I work with just don't understand why black people don't want to be involved in these clinical trials. I'm like, you have to do your research and history to really understand the effect. And for me, that was like one of the reasons why I even got in healthcare, because you trust somebody who looked like you. So if I can go to someone and say, hey, I'm on this, it's ethical, I'm going to have your back, like this is going to be something that's not going to harm you, that will build more trust in our communities and more education and knowledge when they see representation involved in some of these clinical studies. So I'm glad we have all of us in the room to actually try to build some of that trust that was dismantled.
Yeah, and I know we can all, I can speak for all of us when I say that that's a pride point for our jobs, like choosing that makes us feel good. Like,
Absolutely.
So that's awesome. All right. So India mentioned that like black people respond differently when they see us in healthcare, just because they feel like they can trust us. So we wanted to ask you, Derwin, if you thought that black men respond to you as a healthcare provider in a good way or a bad way, and what impact that has on you.
Yeah, so I want to say it's a little bit of a 50-50, and I think this conversation is important because us as black healthcare professionals, we need to progress, we need to move forward, we need to instill that trust in each other. Because if you think about that Tuskegee experiment, there was a nurse at the time that was going to those black communities. She was a black nurse herself. So you see these black men looking at this black woman, is like, okay, she looks like me, maybe I can trust. I still, to this day, see some people, some black men, black women, black children, that when I tell them I'm a doctor of physical therapy, they kind of look me up and down like, you? Like, you know what I'm saying? Like how, you know? But I think a lot of that is what was instilled with us from a slavery standpoint. And I think that it's important for us to all lift each other up.
Absolutely.
To edify one another, to, you know, if you have a degree and you walk into the room, it's important for you guys to, you know, just celebrate each other. On the flip side of that, there are people that are breaking free from that that lack of trust. Like, man, here is a black man that is giving me that motivation, giving me that hope. And I think any healthcare professional needs to make a mission to dive into those areas, like those schools, those underprivileged areas in this country that they don't see representation.
Right. Mm-hmm. You said something that stood out to me. You were, mentioning that it's not always a good response. And I definitely feel like that comes from the history of our people just going through so much and not having the opportunities. And so it's like, still to this day, even though we obviously are seeing that it's possible, I think it's just kind of engraved in us from a historical standpoint of, we weren't able to get an education, let alone a doctorate degree. And so now a lot of us, it's instilled inside of us that wasn't possible. So then when it happens, it's like, what? Like a black doctor? Like, you sure? You sure you got this?
Unbelievable.
Like, exactly.
Which is very sad.
And on top of that, though, like when, we have to build our own, we had to build our own universities and schools or whatever. And of course, they're not funded, right? So some people will look at you and say, oh, you might have got your degree from a school that's really not as well-known and prestige as a different one, so you might not be the best doctor as someone of a different race. And it's hard to kind of like break that association that you're not as smart as the other people who look like you, because we didn't have the resources, but like we built our own, like university, schools, and teaching, which is crazy to me.
And on the flip side of that, you have people from those schools who look at you and question why you chose a PWI when we had HBCUs available, when it's just like, for me personally, I did what was best for me, and it was never anything against those schools.
Right.
But it's so sad that we're battling like both sides of it. Like on one end, people are like lifting you up for making those decisions, and on the other end, it's almost like you're a traitor. So it's like a lose-lose situation sometimes.
I just wanted to weigh in a little bit more on like the strength, the masculinity topic that we all talked about. As a man, like, it's our job to be providers. It's our job to be that strong individual that when times are getting rough, that you can rely on us, And I think that we've been taught to kind of just, if you have an ache or if you have a pain, if you can still get out of bed, if you can still go make your money, don't worry about it. You know what I'm saying? Like, is what I'm struggling with truly gonna keep me from getting the bag? And a lot of us like wait until it's too late because, man, like we go to the doctor and we go because our leg is broken. You know
exactly. Because then now at this point you can't do what you need to do, so you don't have a choice.
So this is affecting the back. You know what I'm saying? But I knew about this knee pain, or I knew about this shoulder pain that I was having for months and years, and I just kept telling myself, oh, it's going to get better. On the flip side of that too, like financially, you talk about deductibles, you talk about copay. We have to, like, a lot of people don't truly understand what a deductible is, but if you want to make an appointment at the doctor, the first question you have is, how much is this?
Exactly.
I have men in my family that they say, instead of calling 911 for me, let me die. Because they don't want to deal with that financial burden of an ambulance transfer,
I don't know that is.
It's not.
It really is. Oh my goodness. I'm still paying
without insurance. I'm like, even with insurance, it's a lot of money. So you bring up a great point, like those social determinants of health, which is so important in our community because some people don't think about that. Like, we are privileged enough. I feel like everyone in this room have had insurance. We're privileged enough to literally, if something is hurting us, we can go to the hospital. But what do we do about the people who don't have insurance? But I would still encourage it because that little ache and pain may not cost you as much as having to get an amputation, or if you really break anything, whatever. Like, it can get worse. The longer you wait, honestly, the worse it can get, and the more it will be. So, honestly, I'm like a prevention, like, you got to be proactive instead of reactive type of person. So I encourage, like, the earlier the better for the provider and for you to, like, get you back to your normal health and to get you back to the bag.
The bag. So speaking on proactive, like, as a man, like, what do you find to be the trigger to actually, and I know you're in the healthcare field, so that might differ from some of the audience, but some people, it's their wife. I know with my husband, it's me. I have to be the person to continue to like push him to go. Like, have you seen anything specifically, whether it's you or other men, like kind of actually be a trigger and get over that hump to lead to proactive care?
Yeah, like you said, I think having a good support system is helpful for that, because us as men, we're kind of just like, I don't really need to take care of this now. If it's not debilitating me, if I can still do my daily activities of daily living, why do I need to truly go to a doctor? You know, this research that you bring up, 1 in 4 black men have prostate cancer. I mean, that's real, and I think that's why us as healthcare professionals need to continue to educate our community to let them know, like, yeah, 1 in 4 black men have prostate cancer, but if you attacked it earlier, if you were able to identify that little tingle that you felt then, like these are conversations that need to happen. We could have prevented this a long time ago.
Absolutely.
I have a question for you
Sure.
too.
Yeah.
We're putting you on spot, but you're our guest. Since you are now a healthcare provider, do your family listen to you? Like, do they take your advice? Like, do you at least try and help them? Like, hey, this is serious.
Yeah.
And if so, like, do they actually listen?
Man, there's some of my family, they listen to a T. I remember
Okay.
my grandma, she hurt her knee one time, and I sent her a picture. I was like, Grandma, you need to lay down and elevate your leg above your heart. Sent her a picture. She did exactly what was on that picture. I mean, I'm talking about the color of the actual towel that the person
Yes, Grandma.
I love that.
And then I got some uncles, you know, they're like, what you know, boy?
Yep.
That little crumb snatcher was running around.
So is it a man versus woman thing, man?
Right,
Like, is the
that's
women
what it
listen
sounds
to you
like.
and the men don't? Like, is it going back to that again? Like the
I mean, I think men versus women, that's a strong term, but I think it goes back to that masculinity.
Yeah,
thing,
exactly.
You know? Just, man, I'm good. It's just a little ache,
Mhm.
pain in my shoulder. I'll be all right. But a lot of us men don't know that ache and pain could be indicative of a cardiovascular issue.
Absolutely.
You know?
or cancer or anything.
Anything, yeah.
So those conversations need to happen amongst men,
Definitely.
and amongst men and women for sure.
Yeah. It sounds like us as women need to encourage the men in our life.
Yeah,
Because
I think
apparently
so.
they're going to listen to us.
I'm telling you, we have some type of
Yeah.
magic effect on them. Like when we say it and we keep pushing it, I
Maybe they
figure
just-
that's the trigger.
Of course.
Maybe they just don't want us to nag.
All right. Maybe they just tired of hearing her mouth say, like, let me go.
I'm trying to be optimistic.
There we go.
That's the truth.
They're gonna be honest. They gonna like, she gonna say this again tomorrow. Like, let me just go.
Whatever works.
But I'm gonna nag you if it's gonna save your life. I'm
Yes.
gonna nag you and nag you because it's worth it.
Mm-hmm.
I agree.
Be mad later.
Yeah. Thank me later. How about that?
All right, Derwin. So, what advice do you have for minority males interested in a healthcare career?
My biggest advice is just face adversity, like overcome adversity. And we need you, like our people, we need you, man. We need that education. How much is our community dying because of lack of knowledge, lack of education, lack of awareness? You know, who is going to invest in us besides us? You know,
Absolutely.
I mean, I think that, of course, don't get me wrong. There's a lot of majority that invest in our community,
Absolutely.
but it starts with us.
Yeah.
For sure. So face adversity. Failure does not mean defeat. If you don't get accepted into a school your first time, try again. It took me 3 times to get into PT school.
And look at you now.
Of course.
But I
Sounds like
love
this is
the
fire.
fact though that you're in PT, because a lot of times, like, the number one thing that our community goes to is physician, which is something commonly known, but people don't know about PT, right?
Mhm.
You honestly are the first black male PT that I have seen, and I'm in the healthcare professional. So it's just knowing that there are multiple fields that you can get in healthcare and actually help our
And be
community. I think
impactful.
is a beautiful thing.
Yes, because we need you in every sector. Like, we can't just rely on the doctors because they can't do it all, and you're gonna need someone else in healthcare that's not a doctor, whether that's a physical therapist, an occupational therapist,
A pharmacist.
a pharmacist, a speech language pathologist. Like, we need you in every sector. And just to go off that, like he said, like, it starts with us, but we gotta appreciate those allies and healthcare providers who
Absolutely.
truly make a difference. So we appreciate that, and we encourage others to learn more about Black health and be a part of the allies, because you know it's going to take all of us to improve the healthcare system and not just us. So well, we want to thank Derwin for this awesome episode.
Thank you so much.
We truly appreciate your perspective, because we couldn't do this without you.
I just want to say again, thank you, ladies, for allowing me to be here. This is an amazing opportunity. The podcast is great. I don't know if Justice told you, but we went to physical therapy school with each other. And I listened to one of your podcasts in the past, and y'all talked about life be life. And I want to say that this queen right here is probably one of the strongest women that I've ever
That
met
we all know.
in my life, you know. So to see all the adversity that you went through and sitting here right now doing this is amazing. So
wow, I really appreciate that, and I wouldn't be here without you, my friend. I wouldn't be here without you. Like he said, life be life, and I said on that video that I remember crying in that room because I'm like, I'm done. And you were there, so I really, really appreciate that. Definitely.
for sure.
But again, thank you so much for being here. And as always, keep it pretty.
As always, thank you for joining us for the ride. Be sure to keep in touch by following us on Instagram and subscribing to our YouTube channel at Pretty in Practice. Feel free to send us a DM of any topics you want us to discuss, and you might hear them on a future Pretty in Practice episode. Keep it pretty.